This chapter is very important. I have already covered this, but today we will mainly do a first revision. It will be a short class. So the first thing you have to remember, I think most of you know the topic. It's respiratory physiology today, and so let me share the board first. Okay, I think the board is visible. Just hold on. Okay, all right. So now the board is visible to you. Yes. All right. So the first thing from the breathing and respiration, there are many segments from which the question can be asked. The first segment, I think you already know, the anatomy segment. Okay, this is the anatomy segment of the respiratory part. There are many questions from the anatomy segment of the respiratory part. I am just asking one by one. The first question is first question from the anatomy segment, and all of you are requested to please turn on the video. All of you are requested, please turn on the video. All right. So the first segment that you have to remember from the anatomy, the first upper respiratory and the lower respiratory tract. What is upper respiratory tract? From the nostrils, okay, from the nostrils to the vocal cord, okay, up to this is called upper respiratory passage, okay. Below the vocal cord to the lungs is called lower respiratory passage. This concept is clear to everyone? First, you will let me know. Okay, so when I'm saying this is something called respiratory physiology or respiratory system, you have to be very sure that you know that two part of the respiratory system, I mean respiratory physiology, something is called URT, that is upper respiratory tract, and another is called LRT, lower respiratory tract. So what is upper respiratory tract? What is lower respiratory tract? Definitely it will start from the nose and it will end in the lungs or lungs alveoli. But who will divide it into upper and lower? This which structure divides? Yeah, it's larynx, and the better answer is vocal cord. If in your exam you get the options vocal cord, it's better answer. If not, then you have to mention larynx, because larynx, vocal cord stays inside the larynx. This is my larynx. You can see this is my larynx. This is something is called elevated portion. It's called Adam's apple. Okay, next question comes on this point. But before that, first we are first note it down. The first question from NCERT. Every point that I will say, I will mention is directly from the NCERT, and it's very, very important. Okay. So the first thing you have to know actually that which part actually divides the upper and lower respiratory tract, and you have to mention larynx. Okay. To be very precise, the answer will be, tell me, VC. What is VC? Not Vice Chancellor. VC means
vocal cord.
Vocal cord. It's absolutely correct. So vocal cord is something which will actually differentiate the upper and the lower respiratory. The first MCQ. The second MCQ is that the MCQ on larynx. Let me finish the MCQ on larynx first. So first question on the larynx, which is very popular for NEET exam. First question, second question, actually not first question is already done. Second question on larynx. Larynx is a box which is made up of bones or cartilage. Bones or cartilage? Cartilage. Absolutely correct answer. Next question: how many cartilage you will get in the larynx? How many cartilages? How many cartilages you will get in the larynx? How many cartilages you will get in the larynx? Tell me. Cartilage is the correct answer. Then you tell me how many cartilage you will get in the larynx. How many cartilage you will get? Okay. Not 6. Anyone else? Tanushree?
9.
Okay. 9 is the correct answer. 9 is the correct answer. This is a revision session. If anyone is new here, I don't know if anyone is new here or not. Don't worry, beta. Every video, every detailed video are already in your website account. Go and search that video. This is for the revision. Do attend and enjoy this class, because this class will be in the question answer format. I will ask you question, you will answer. If you are not answering, don't worry. Your friend will answer, and you should register in it the same information in your brain, because those are most common questions we are discussing today for NEET exam. And every question is already in NCERT lines. All right. So if I talk about the cartilage, the direct answer will be 9. So if it is 9, the next question will be, out of this 9 cartilage, how many are paired? How many are unpaired? Tell me, beta, how many are paired? And how many are unpaired? So if I say paired, remember paired is 3, unpaired is also 3. So how sir we are getting 9? Because 3 into 2 paired is, so 3 into 2 is equal to 6, and 3 into 1 is equal to 3. So total it's 9. Clear everyone? Yes or no, beta?
Yes, sir.
Okay, all right. So next question directly will be asked to you. What is the name of the paired cartilage? What are those three? 1, 2, 3. And what is the name of this unpaired cartilage? 1, 2, 3. So who can volunteer this answer? Anyone? What are the names of paired cartilage? What are the names of paired cartilage of the larynx? What are the names of paired cartilage in the larynx? Who can tell me the answer? No one. Paired cartilage of the larynx. Okay, tell me what are the unpaired cartilage of the larynx?
Thyroid, Epiglottis.
Very good. 3 are unpaired. If you remember this, other 3 are paired. Okay, so unpaired are thyroid. Second one is cricoid and epiglottis. Thyroid, cricoid, and epiglottis are unpaired. Now, next question, which are paired? So, directly answer will be arytenoid, cuneiform, and corniculate. Corniculate. Which are now, so this is arytenoid, cuneiform, and corniculate. Do you have any doubt, beta? Do you have any doubt?
No,
Okay,
sir.
all right. So the next thing that you have to understand, out of these 9 cartilages, which type of histology, I mean, which type of tissue it is? Which type of tissue it is? Out of this 9 cartilage, which type of tissue it is? I mean, which type of cartilage? You know, okay, can you tell me how many cartilages do you have? If you have the concept of the animal tissue that I have already taught, and you have already that video in the video bank, if you have seen that video as well, that is the animal tissue. That's the main chapter. Can you tell me how many type of cartilage we have in our body? Okay, I am showing you. This is one type of cartilage I have. Yeah, okay, absolutely correct answer. 3 types. Can you tell me what are the types?
Hyaline cartilage, elastic cartilage, and fibrous cartilage.
Correct answer. Absolutely correct answer. Very good. So 3 types of cartilage you have. Someone is called hyaline. What is the meaning of hyaline? Hyaline means glass. Okay, hyaline means glass. Okay, so first 3 type of hyaline, glass. So what is the meaning of glass? Glass means it's a very clear. It's like a glass. If you want to pass your rays to the hyaline cartilage, it will pass. So it's a very clean, clear cartilage. It's called hyaline. Now, next question is why it is clean? Because it consists of least amount of fiber. Which fiber? You know, collagen or elastin I'm talking about. So in hyaline cartilage, the fibrous component least. That's why it's very clean. It's only made up of matrix, chondroitin sulfate matrix. Other fiber is least in fact. Can you tell me after it? It is elastic. So can you tell me, but most important MCQ, where do you find the hyaline cartilage? In the joints. You will find some joints, definitely you know. Okay, and these joints you will have something is called hyaline cartilage at the end of the bones. Suppose this is the bone. Let me draw actually. Suppose this is the bones. Okay, at the end of the bones you will have some cartilaginous area, which actually, where actually if you deposit calcium, you will get the bone growth. Okay, that's a different thing. But right now I'm saying this is the something called articular cartilage. Okay, all right. So this is the cartilage. So in the articular cartilage, you will get hyaline. Number 1. Number 2, very important. Hyaline cartilage is present in all respiration related cartilage. If I say the nasal septum, this is the nasal septum. I mean, at the midline, we have a nasal septum. So the nasal septum you can touch, actually basically made up of cartilage, and that is hyaline cartilage. But if you touch this one, can you tell me what is this? Do you think this is cartilage? Can you tell me, do you think this is cartilage? No, this is very hard now. So this is actually bone. This bone is called vomer bone, nasal bone, lacrimal bone. There are 3 bones. You can't see it actually right now. If I remove your skin, then you can see the bones. Actually, there are 3 bones actually. This side 3 bones, and here is also 3 bone in the nasal bridge. This is called nasal bridge. Anyways, this is bones actually, but this is actually cartilage. Okay, and this is nasal septum. So nasal septum is something which is made up of. Tell me, beta, which type of cartilage? I have told you. I have told you a trick. Remember, all the respiration related cartilage are hyaline. So this is nasal septum. It's respiration related cartilage. So nasal septum I am drawing for you because it will help you to remember for long. So this is the nasal septum. Okay, this is actually hyaline cartilage. Okay, all right, beta. Now NS, you can write NS, not normal saline. This is nasal septum. Okay. Anything else? If I say about the laryngeal cartilage, if I say the laryngeal cartilage, okay, if I say larynx cartilage, if I say larynx cartilage, again the same answer, because why, beta? Why you are saying? Because very good. So you have to know the tricks I have already mentioned. Okay, if this is the number 1, this is the number 2, and this is number 3, I'm just asking you about the number 4. If I say you the tracheal ring, I think you know the tracheal ring, na? The bacha wala information, tracheal ring. Along the whole trachea, you will get the rings. How many rings? 18 to 20 rings. Okay, these rings you can find not only the trachea, but even you can find that ring. Can you tell me better? Yeah, very good, excellent answer. Not in bronchial. That is another trap. Not in bronchial. Up to bronchus. Yes, that's the question. That tracheal, and even it is written in NCERT. Listen, I will not mention anything in the class which is not written in the NCERT. I will only mention those informations which is written in NCERT. Okay, so this is another MCQ, that tracheal ring can be present up to bronchus, not in bronchial. And that is how, when you read anatomy in the first year on your medical schools, then you can find, then you can differentiate. Your anatomy teacher will tell you, can you differentiate the bronchus and bronchial? Then you have to feel that will be a normal original viscera. A lung of a dead body will be given to you. Okay, and then you have to tell that this is like the bronchus and this is the bronchial. How you can tell that? So you will feel that. If you feel in the tube, suppose this is the tube, suppose this is the tube-like structure, it might be a bronchus, it might be a bronchial. You are confused, then you have to feel. If you find any ring-like structure which is supposed to be a cartilage type of thing, then you will say yes, it is not a bronchial. But when you feel there is no such structure, then you can say no, sir, this is bronchial actually. Okay, so this is another question we have covered in form of a story, and this is also written in NCERT. Okay, so what are the different hyaline cartilages we have read? So we have combined all the concepts of MCQ from animal tissue, from respiratory physiology. Okay, and the final answer is these are the hyaline cartilage. Okay, trachea. Okay, and this is primary bronchus. Not bronchial. How should I write bronchus and bronchial? We should not write L. So we can write like this, bronchus. Okay, primary bronchus, not bronchial. So primary bronchus, trachea. Okay, and this is the articular cartilage, Okay, articular cartilage. This is nasal septum. This is the laryngeal cartilage. These are the best example of the hyaline cartilage in your syllabus. You have to remember it. And along with that, why it is hyaline? It's a glass-like cartilage. Okay, why it is hyaline? It's a glass-like cartilage. You have to remember this is a glass-like cartilage, and importantly, it's a glass-like cartilage. And importantly, you have to remember why it's a glass-like, because write down another MCQ beta along with what is glass-like. Why it is glass-like beta? Because
due to lack of collagen.
Not lack, least, not lack. If I say lack, then how can I say this is a connective tissue? This is the property of the, yes, because first you have to satisfy the criteria of the connective tissue. You know what are the 3 criteria of the connective tissue? Number 1, cell. Number 2, fiber. Number 3, matrix. So if I remove completely the fiber, then I can't mention hyaline cartilage as connective tissue. Okay, so as it is cartilage is a connective tissue, be it hyaline or elastic or your fibrous. So I have to mention least fiber. Clear, everyone, beta? Clear? Yes or no?
Yes.
Yes, sir. Yes, sir. Yes, sir.
Okay. All right. It's very good. And next thing you have to remember from the elastic cartilage. So we have covered. Can you find that we have discussed this story with two aspects: animal tissue aspect, example aspect, and respiratory physiology, related to relation with the respiratory physiology. Now we are talking about the elastic cartilage. So if I talk about the elastic cartilage again, if we summarize all the chapter, the first question, the first comparison here, it was the least fiber. What you are expecting in the elastic cartilage? Least fiber? Are you expecting? Okay, let me show you the elastic cartilage. Okay, this is my elastic cartilage. Okay, this is my elastic cartilage. This. Okay, don't say. Many people, I still found many people are saying this is the elastic cartilage. This is not the elastic cartilage. This is a soft tissue. This is a soft tissue. This is a soft tissue. This is not the elastic cartilage. The elastic cartilage is this. The pinna, the main pinna. This is the elastic cartilage. Okay, this is a soft tissue. Don't think that you know the girls are wearing rings. This is not the cartilage. The girls are wearing rings in the soft tissue. Okay, yeah, you can pierce. That's a different thing. If you want to pierce the connective tissue, I mean the cartilage, that's a different tissue. But most of the time, what we find the girls are piercing is basically on the soft tissue. So this is the cartilage. If you can feel, cartilage has a ply-like feeling. Okay, plywood or like ply type of feeling. Okay, okay, this is something called ply type of feeling. This ply type of feeling you will get in the cartilage. So elastic cartilage, it is not least fiber. It is having fiber, but which type of fiber? Elastic or elastin or collagen? Its name itself mentioning that the fiber will be elastin, not collagen. So the next, so if we compare this point with the previous one, it is least. Wherever we can say this, what we have to say, this is we have fibers, but that fiber is mostly elastin. So elastin fiber. Okay, elastin fiber I can write here. It's more like this. Okay, if I compare the next point, like the examples, if you compare the examples for the elastic cartilage is directly, you have to say the pinna. Okay, I can write it here, pinna. Okay, but one thing I want to mention, okay, it's a pinna. I just want to tell you one more point here, that not only the respiratory physiology, if you see the respiratory physiology, it is more of related with the hyaline cartilage. But if I say the auditory system, I mean, if you know the hearing system, can you tell me what is this? I'm just drawing you, and you have to say yourself. Okay, this is something I have drawn. Okay, beta, this is something I have drawn. This is something I have drawn. Okay, this is something I have drawn. Okay, this is the cavity. This is called middle ear cavity. Okay, and this is something which will directly communicate inside the nasopharynx, inside your mouth. Can you tell me, beta, what is this?
Eustachian tube.
Absolutely correct answer. Eustachian tube. Can you tell me how Eustachian tube is made up of? Which cartilage? I have already told you.
Hyaline cartilage.
No. Do you think it is elastin? So how you can remember that, be it pinna or be it your ET tube, I mean Eustachian tube. So you have to remember this concept that when I'm saying this as like what to say, like hearing, then you have to answer this as like yeah. So you have to answer this like here, elastic cartilage. Okay, so when I'm saying that it is related with the auditory system or listening or your hearing system, you can answer that it is pinna and Eustachian tube, which is hearing system. That's why we are answering this. Are you getting me? Yes or no? Okay. Yes. Now I will tell you. Now this is an exceptional MCQ actually. Why this is exceptional? All the respiratory cartilage, if I say all the respiratory cartilages are mainly made up of the hyaline cartilage except one. I mean, all those 9 cartilages, out of 9, 8 cartilages are hyaline, but not one. Can you tell me the name of that one?
Epiglottis.
Epiglottis.
I'm just saying you, it's very easy. It's very easy to actually tell that one is actually also made up of with E. Its name also begins with E. So it's easy for you to remember. Can you tell me? It's easy for you to remember.
Epiglottis.
So yeah, epiglottis is answer. So epiglottis is answer.
Sir, epiglottis to পুরোপুরি tracheal system এর মধ্যে পড়ছে না.
I have not told the tracheal system, but it is in the laryngeal system. So I am including it in the larynx. Out of those 9, I am saying this. Here I have written though this one. Okay.
Yes, sir.
Okay, all right. Okay, very good. Do you have any confusions? Do you have any confusion? Anyone? Any confusion, beta? Anyone? Any confusion?
No, sir.
Okay, all right. Okay, all right. So the next important thing that you have to know right now is the example of which one? Everyone, please turn on the video. Please turn on the video. Everyone turn on the video, because after few days, if you are not turning on the video, you will not be able to join the class. This feature is coming very soon. So try to make practice, because you have to do this. Otherwise you can't join the class after a few days. Anyways, so the next one is, okay, just hold on. Okay, what happened? Just hold on. Yeah, all right. Okay, the next one is, if I say so this is elastic cartilage, and last but not the least, which one better? Last but not the least, which category of cartilage we are talking about mainly? Yeah, fibrous. So if I say the fibrous, number 3, if I say the fibrous, so one thing you have to know, in the fibrous cartilage, again, it's a very, very important. One example in the NEET exam that will come in the, that is repeatedly coming actually. So if I draw this one, I think you know what I am structure drawing. Can you tell me what the structure I'm drawing? What is the structure? Can you tell me, beta? What is the structure I'm drawing?
Spinal cord.
This is spinal cord. No, beta. This is something bones, related to the bones. This is vertebrae is the plural, vertebra is the single. So it is, you can say it's a vertebrae, because we can see this is actually just one vertebra, this is second vertebra. So this is something called intervertebral disc. This intervertebral disc is also made up of some cartilage, which is called fibrous. It is called white fibrous, actually, white fibrous cartilage. Okay, this is very, very important, because I don't know why people choose this MCQ for the NEET exam repeatedly. This is a very repeatedly asked MCQ. Those who are solving MCQ, you will also agree to me. So, clear everyone?
Yes, sir.
All right. So these are the questions we have covered right now. And the next thing we have to, so epiglottis is a MCQ because it is not hyaline, it is rather it's elastic. That was the point. To discuss this point, I told the whole story because I found this will give you some interest. So anyways, the next one.
Sir, epiglottis ke to sir elastic hote hi hobe, noile to sir নাড়াচাড়া করতে পারবে না।
What's the role of Narachara in epiglottis? Listen, basically
actually sir esophagus মানে একবার যখন
so listen. Okay, listen. Suppose I am writing, my hands made up of cartilage? No. So movement is not dependent whether it is being made up of cartilage or bones. Any structure can move even if it is not made up of cartilage. Clear?
Yes, sir.
Okay, all right. So the next question is, what is Adam's apple? Who can tell me what is Adam's apple? Which cartilage is Adam's apple, beta? Which cartilage is Adam's apple?
So
that's a direct question. V-shaped part, correct, but which cartilage? You have to say the first answer now. Oh my god, I am saying that which cartilage out of this 9 cartilage? Which cartilage is Adam's apple? Okay, I'm giving you hints. It's an unpaired cartilage. Yeah, absolutely correct. As a thyroid cartilage. Thyroid cartilage is hyaline cartilage. Cartilage is Adam's apple. So this is the Adam's apple actually. If you see the larynx, suppose this is the larynx. If this is the entire larynx, is the voice box entirely. Interiorly there will be some book, like the open book structure. Okay, like open book. It will be like this. Okay, and this is your actually thyroid cartilage. Okay, so this is the pointed edge actually. This is the pointed part. Otherwise, it is open book structure like this and this. So what I'm to say, this Adam's apple is more Okay, it will be prominent for the boys. Okay, it will be prominent for the boys. Why it's prominent for the boys? Because this cartilage will grow and grow, and this thyroid cartilage will be bigger in case of boys due to the actions of testosterone. Okay, it's very important. Next question. So Adam's apple. So Adam's apple is thyroid gland or thyroid cartilage? Next question. Adam's apple, thyroid gland or thyroid cartilage?
Cartilage.
Cartilage. Very good. Next question to you. What is the difference between thyroid glands and thyroid cartilage? What is the locations of the thyroid gland and what is the locations of the thyroid cartilage? If I want to answer this question, then first I have to draw the larynx. This is my larynx I'm drawing. Okay, this is a voice box. You can see I'm drawing. And if it is an anterior, this anterior portion is mainly made up of thyroid cartilage. Though there are other 8 cartilages, total 9 cartilages are placed in this way. It is like it's like this. Okay, they're present in such a way they are ultimately making a box. Okay, so next question, can you tell me that if this is a box, at the top of the box there is an opening. Okay, there is and the role of this opening is actually to pass air. It might be inhaling, it might be exhaling. Okay, can you tell me the name of the holes which
The glottis.
is at the top of the box? Glottis. Very good. And if this is the glottis, there is a structure part of the box itself, which is a part of the box. If you need to open your mouth in a bigger way and just in front of the mirror, you can find something is like snake-like structure is coming from you. So if you ever make a big opening of your mouth, okay, you will find in front of the mirror and put a flashlight of your phone. You can see that something structure when you depress your tongue, like this is your tongue. You depress your tongue in a good way, then you can find some structure is trying to peep up. Okay, so this is like from the back. You can see the structure which is actually part of this box, but you can see that is coming, that is trying to come out. Okay, not out actually, it is trying to come above. Okay, that is something is called epiglottis. Okay, so this is the epiglottis. What is the purpose of the epiglottis? Epiglottis is the cover of the glottis. It will cover, but when it will cover? During the air entry? No. Air entry is always welcome. When any unwelcome substance, it might be fluid, it might be water, it might be any solid particle, it might be any foreign body, it might be anything. It might be your rice grain, anything. Whenever you find that they're basically trying to, whenever the larynx will find that something unwanted particle is trying to enter inside the glottis, they will simply cover it up, and that is called epiglottis. Okay, all right. The next one. So this is the thyroid. My question was, what is the difference between the thyroid cartilage and thyroid gland? So here, till now, I have explained the concept of thyroid cartilage. Right now, I'm going to explain the another one. So if this is the tube, the tracheal tube, in the tracheal tube, you have rings. Suppose this is the first ring, this is the second ring, this is the third ring, this is the fourth ring. So, and you can say this is the fifth ring. Okay, it's also important. This fifth ring is also important. Okay, so can you tell me that why I have drawn these rings? Because you have to remember there's a gland which is called thyroid gland, which is an endocrine gland which produces the hormone thyroxine, which is residing from the level of the second tracheal ring to the, this is the first one, second tracheal ring, third, fourth, up to the fourth tracheal ring. So if I say, and this is my thyroid gland, this is the right lobe of my thyroid, this is the left lobe of my thyroid, and there's a connecting part which is called bridge, or in Latin which is called isthmus. Isthmus is another name of bridge. Okay, so this is the right lobe of, right? This is the left lobe of thyroid. Yeah, so yes, yeah.
It's a butterfly structure.
Yeah, you can imagine in your way. So this might be a butterfly. So there is something called isthmus or bridging portions, and other is like the glands. Okay, it's a gland. Can you tell me a gland is made up of which type of tissue? Again, I am hitting your animal tissue concept. A gland is made up of which type of tissue? Option A, epithelial. Option B, connective. Option C, muscular. Option D, nervous. A gland is made up of any gland you can consider. Pancreatic gland, intestinal. Absolutely correct answer. Absolutely correct answer. Very good concept. I have already told you. Just think in this way. If this is the epithelial tissue, like the cells are arranged on your basement membrane, And if I simply arrange it, I can arrange it in this way. Okay, I can arrange it in this way. Okay, if and depending on that, they are known as tubular gland or acinar gland, and the complexity are packed in a way, they are packed together in a small organ, and that is known as gland actually. Okay, though you know that there is a unicellular gland as well, which is known as, I think everyone knows, the unicellular gland, single cell, single gland. The gland is made up of one cell, which is looking like an inverted wine glass. You know that is called goblet cell. Goblet cell is a single cell, single gland. I mean, it's such a gland. It's a single cell. Goblet cell is a cell which itself is considered as a gland. Do you know now? Goblet cell is a cell. It's a cell having beautiful nucleus and other organelles, and each individual cell is considered as, better tell me. Every cell, I mean, one cell of this goblet cell is considered as, tell me, gland. Clear everyone, yes or no?
Yes,
Yes,
sir.
sir.
Okay, all right. So the next question to you, at which level? So I think now you are pretty confident about it, that what is the difference between the thyroid cartilage and thyroid gland. Okay, all right. Okay, next question, at which level? Suppose this is the tracheal, suppose this is the trachea. You know, in the back you have vertebrae. In the back you have, tell me beta, in the back what you have? Vertebrae, I mean the bone structure. So can you tell me at which vertebral level this trachea will divide? That's a question actually. I mean, where the trachea is dividing into the right primary bronchus and the left primary bronchus. What is present at back? Which vertebra is present at back? There's a question is present in your NCRT.
Thoracic.
No. Number. You have to say the number. Thoracic. I agree.
It is
Thoracic.
thoracic.
Because cervical is ending here, so definitely it will be thoracic because it is dividing in the chest. But can you tell me at which level?
Fifth thoracic.
Very good.
Fifth
It is
thoracic.
T5. That's MCQ. At the T5 level, it is dividing. All right, beta. Chalo. The next level of MCQ from exactly of your NCRT, which is again very, very important. Okay. Can you tell me, actually, I think this is not in NCRT, but still it's actually a bit important, I feel. This is the right bronchus, this is the left bronchus, and there is a bit difference. Okay, I'm just explaining the difference. If you follow my diagram, you yourself can tell the answer. So this is something you have to know. Yeah, this one. You just tell me what I have drawn. Can you tell me what is this, beta? What you are finding? Which one is more vertical? Right primary bronchus. This is called right main bronchus or right primary bronchus, whatever you can say. This is a left main bronchus or left primary bronchus. Which one is more vertical?
Left.
Left is more
Left.
vertical.
Right.
Which one is more vertical? I mean, which is making less angle with the vertical?
Right.
Right. So what is the importance of it? Where you will get more infection? Right or left?
Right.
Why?
It's broader.
Broader and number one. Very good. Good observation. It is broader. So any bacteria or virus, anything that can come easily in the right. That's a good answer. Second thing, how you can forget about the gravity wala G? How you can forget about the gravity wala G? So if any organism, it is having I know it's having a very low weight, but still having weight na. So you can say that the right one through the right primary bronchus, the organism can easily pass. Number one, because less angle. Number two, broad way. Okay. And also the path is least. You can reach your success in this way. You can reach your success in this way. What do you prefer? Often or definitely the first way. So what bacteria will prefer to go in because it's a parasite actions. So bacteria will always try to follow the path of least resistance. Okay, that's why it will choose the broader one, smaller one, and it will take the advantage of G, gravity. All right. So these are the questions that you have to know basically from the anatomy, though it's not entirely over right now, because at the lower respiratory tract as well, there is another question. So I just want to take another page. Yeah, this one. So that question is, if this is the right main bronchus, is the left main bronchus. Oh, this is the left main bronchus. I should draw in a different way. Yeah. So if I draw in this way, there is a branching and branching and branching. I'm not telling you right now. What you have to remember, suppose this is the lungs. The next question is coming directly from the lungs. Can you tell me how many lobes are there in the lungs in the right lung? And how many lobes are there in the left lung? Can you tell me? In the right lung, you have 1, 2, 3 lobes. In the left lung, you have only 2 lobes. So how, sir, I can remember this? Because you remember in the left lobe, the space is less. Sir, why in the left lung, the space is less? Because I have to accommodate heart. Clear, beta? Yes or no? Clear, everyone? Yes or no?
Yes, sir.
Yes, sir.
Yes, sir.
Okay.
Yes.
So I just want to tell you, so who is actually dividing the right lung into 2 lobes? This is fissure. This is called fissure. What is the name of this fissure? What is the name of the above this? This fissure is known as transverse fissure. Not in NCERT, so no need to remember. But just I am saying this is called oblique fissure. But in right one, which fissure is only there? Only the oblique. So which one is missing in the the right is the left. So in the left, which fissure is missing, beta? In left, which fissure is missing? Transverse fissure. Okay, so that's enough. But the most important MCQ that I am going to tell right now. Okay, the important question is that air exchange. It's a very important question. Very important. Very important. Air exchange. Air exchange. Okay, air exchange. Okay, and another is the air passage or air carry, or you can say air passage. Okay, so if I say my lung is for air, my tracheal tube, I mean my air pipe is for air passage as well as air exchange with, tell me whom? Blood. Are you getting me? Yes or no? This is actually called diffusion process. So my question is that, can you tell me if I consider from the trachea, and if I consider other ways as well, like these and these and these and these and this, can you tell me the initial part? Do you think the initial part of the air pipe will help you for exchange of the gas with the I guess this is the blood? Do you think this is my airway? Do you think the initial part will exchange of gas? Better tell me. Tell me, yes or no?
No, sir.
The initial part of the airway, will it help you for exchange oxygen and carbon dioxide from its nearby blood vessels?
No.
No. Why no? Because the walls are very thick here. The walls of the airway are very thick here. You can't expect a diffusion, because the formula for diffusion. What is the formula for the diffusion? The rate of diffusion is directly proportional to the pressure gradient or concentration gradient. Okay, but inversely proportional to the D. D means thickness. D means the thickness. So here the thickness is very high. So you can't expect a diffusion process. So what is the role of this area? So what is the role of this area? I mean, this initial area of the air pipe, only the air passage, and that is called conduction zone. That is called conduction zone. But if you go beyond it, and if you reach up to the terminal bronchiole, I mean, if you reach beyond the terminal bronchiole, I mean, from the glottis to the terminal bronchiole, it is something called exchange zone. But if you reach the respiratory bronchiole, if you reach the alveolar duct and alveoli, this last 3 area they can only make exchange of gaseous with surrounding, I mean blood vessels. So this is called respiratory zone or exchange zone. Clear, everyone?
Yes, sir.
Yes, sir.
So respiratory zone and exchange zone, which are respiratory and exchange zone? Number one is respiratory bronchiole. Plus, this is called alveolar duct. Alveolar duct. And this is called, tell me?
Alveoli.
Alveoli. Clear, everyone? Yes or no? Clear?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So most of the thing, okay, it's a very important thing. So this was another MCQ which is very important and common for the NEET exam. And last but not the least, one anatomy MCQ is very important, which is the structure of the alveoli. So if I say the structure of the alveoli, the next question comes directly to you. Is this a correct diagram of alveoli? The answer is no, because I should draw the alveoli in this format. When I'm drawing any alveoli, a single alveoli should be drawn in this way, not this. So what I'm drawing extra, a single balloon
Sir, your voice is cracking.
Am I audible to everyone? Am I audible to everyone? Yes or no?
Yes, sir.
Yes, sir.
Yes, sir.
Okay, I don't know, something has happened, technical issues might be. So again, we are joining, we were in the middle of the discussions on the alveolar, and I think you have got the small Maggie break in this time being. So I think you can, okay, if anyone want to take any coffee or tea, that you can, but you have to turn on your video, okay? So, all right. So just let me share the board. think it's visible. Yes or no, beta?
Yes, sir.
Okay, all right. So, all right, we were in the middle of the discussions of the structure of the alveoli and its related MCQs. So the first important MCQs that I talked about, when I'm drawing the alveoli, to know the alveoli, you have to draw the alveoli in this way. This is not like a single type of balloon wala gubbara type of thing. It's not like this. This is like this. Okay. If this becomes like your gubbara, then you are a patient of some disease. Can you tell me the name of the disease?
Emphysema.
Very good, very good, very good. Excellent answer. Excellent answer. This is something called emphysema. So the next question, though it's not related to the directly the alveolar structure, but directly related to the anatomy of the alveoli, but these are very important concept. Okay, when I'm teaching you the alveoli anatomy and its MCQ for the NEET exams, this is the first MCQ which is also from your NCERT book. Okay, this is number one MCQ. Second MCQ is that, can you tell me what are the name of the cells which helps? Okay, second MCQ is that, okay, but I have skipped one area. Like this is this is the basement membrane of the alveoli. Okay, follow me. If this is the basement membrane of the alveoli, can you tell me what is this? What is this? Better tell me what is this. At least tell me the which type of cell. Which cell?
Squamous epithelium.
Correct. Absolutely, it's squamous. It has to be squamous because it will exchange actually ultimately. So it's correct. But can you tell me the which what is there's a special name? Pneumocyte type 1 cell. Okay, you can remember. If you don't want, that's a different issue, but you should actually. And the next one is, can you tell me they will exchange gas with whom? They will exchange gases with the surrounding blood vessels like this. Yes or no, beta? Tell me though.
Yes, sir.
Sir. Yes, sir.
Okay, now you have to tell me. This is another very important concept. If you imagine your heart, I think right now your heart is inside your thoracic cavity. Yeah. So if this is your heart, then you know which chamber of the heart will send blood to the lung alveoli. You tell me though, which chamber? Right chamber or the left chamber? Right chamber. Absolutely correct answer. This is the pulmonary artery, right branch, left branch, both of the branch, right. Okay, so this is the right branch will send blood to the right lung, left branch will send blood to the left lung. So if I consider this is my alveoli of my right lung, if I consider, then this branch is coming to the lung and they are again branching and ultimately this is the fortunate or lucky alveoli which is getting blood from the lung, sorry, from the heart. Now, can you tell me that this blood is bad blood or good blood, which is being sent by the right heart? Bad, obviously bad. So bad means CO2 more, O2 less. So what is the purpose of it? The CO2 which is more, it will send CO2 to it, and the O2 which is less, it will receive O2 like this. And ultimately, they will become another blood vessels, which will be a vessel, which will again re-enter into the heart. What are you expecting? These vessels will carry good blood or bad blood?
O2 enriched blood.
Yeah, O2 enriched blood. So obviously it is a good blood. So can you tell me the name of the vessels which will ultimately, what is the name of the vessels which will exit from the lung alveoli?
Pulmonary artery.
How you can say artery? This was your artery. So this is your pulmonary vein. So why I told this? Because this is I want you to feel that really pulmonary artery is an exception which is carrying deoxygenated blood. And pulmonary vein is the exception which is carrying oxygenated blood. This is something I want you to feel. That's why I explain in this way that yes, pulmonary artery is coming and carrying the bad blood. Pulmonary vein is exiting from the alveoli carrying the good blood. Clear, everyone?
Yes, sir.
All right. Okay. The next one is again very important. Can you tell me one? So pulmonary artery is bit of exception because it is not carrying good blood. Can you tell me one more question? I'm telling you in this regard. Can you tell me what is the most typical or fixed criteria of an artery, which will never change? The one and only, which is most important, anything which is starting from the heart. Any vessels, any pipeline which is starting from the heart is artery. Any vessels which is ending in the heart is vein.
Vein.
It will never ever change. Never ever. So any structure which is starting from the heart, always it should be known as artery. Any structure which is ending in the heart, it will be vein. It will never change. This criteria will never change. All right. Okay. Now, next question I am not asking right now because that's a question of different chapter. Right now, I'm just telling you, if this is a squamous epithelium, this pneumocyte cell is helping the gaseous exchange. All right, beta. Next question, you tell me the question on surfactant. Write down the question on surfactant. So what is actually surfactant? Okay. Before telling the surfactant, I want to mention one question actually. That question, what is my respiratory unit or what is my respiratory membrane? That's a question directly from the NCERT, and as much I can remember, up to 2 times or 3 times this question was asked when it was CBSE NEET. Right now, I agree it's not a CBSE NEET, it's a NTA NEET right now. The board of members are a little bit different, not everyone, but some member has been changed from the boards who will be setting the question paper. Anyways, I just want to tell you, it's a very important information that you have to know. What are the part of respiratory exchange membrane or respiratory exchange membrane? What are the layers or what are the layers? So 1, 2, 3, you can say. First you say, beta, I have already explained. Starting from the alveolar end, you say, what is the structure? This structure, tell me. Squamous epithelium. So you can say squamous epithelium, or you can say like type 1 pneumocyte cell, whatever you want. Okay. Second, you tell me, beta.
Basement
After
membrane.
that, basement membrane. You can say actually basement membrane. You can say obviously, but I'm writing in this way. Actually, squamous epithelium with basement membrane. This is the sign of with. Actually, I think you know. This is a sign of with. This one. So okay. And can you tell me the next one? What is this actually? This is called interstitial tissue. Interstitial. Okay, this is not epithelium. These are more of connective tissue. Okay, these are interstitial tissue. Are you getting me, beta? Yes or no?
Yes, sir.
This is like the packing material. Okay, these are like the packing material. So you can write it down as an interstitial tissue. I'm writing in yellow on white. It might be difficult for you. So interstitial tissue. Okay, and the third one, what is the name of it, beta? This is a blood vessel. So you already know in the blood vessels you have some epithelium also on the basement membrane. Can you tell me the name of the epithelium which is present in the blood vessels?
Endothelium.
Very good. With basement membrane. So I can write another epithelium of the blood vessels, and the name of the epithelium of blood vessels is known as, beta? Endothelium. Endothelium is the epithelium of the blood vessels, which is again with basement membrane. So these are the 3 layers you have to remember for if you want your oxygen or carbon dioxide to be exchanged from one compartment, I mean from the alveolar compartment to the blood vessel compartment, or vice versa if you want, then your gas has to traverse through or across these 3 layers. Clear or not?
Yes, sir.
Okay, all right. So this was a very important question I have covered. Next, directly I'm going to the MCQ on surfactant. First question on the surfactant, which is a very popular MCQ, how the surfactant is made up of. What is surfactant actually? If you see the biomolecule, lecithin. So first you have to say at least this is the general answer is phospholipid. Is the first answer. If your teacher is bad enough, he will ask you what type of phospholipid it is. Then you have to say it is a lecithin. If your teacher is more bad, okay, then what will be the answer? after the lecithin? What is the detailed answer of lecithin? Then you have to say, sir, this is something called DPDC. Sorry, DPPC. Sorry, DPP. What is DPPC? DPPC is dipalmitoyl phosphatidyl choline. Again, I'm writing this. I'm erasing this part. So DPPC full form is dipalmitoyl phosphatidyl choline. Phosphatidyl choline is equal to, tell me beta, lecithin. So actually you can also say dipalmitoyl lecithin. Clear everyone? Yes or no? The next question will come to you directly. What are the parts which can produce surfactant? What are the parts in my respiratory passage which can produce surfactant? Then the answer will be, sir, my exchange zone can produce surfactant. Next question, what are the exchange zones? You know already. Respiratory bronchiole, alveolar duct, and alveoli. So next question to you, what is the name of the cell which will produce surfactant in the alveoli? And what is the name of the cell which will produce surfactant in the respiratory bronchiole, or tell me, or alveolar duct? Tell me. So in respiratory bronchiole or alveolar duct, the cell which will produce surfactant, these two, from these two, surfactant will be produced by Clara cell. Okay, and for this alveoli, surfactant will be produced by type 2 pneumocyte cell. Can you remember type 1, which is mainly helping in exchange of gases? It is type 2 pneumocyte cell. Clear everyone?
Yes. Yes,
Do you
sir.
have any doubt?
No, sir.
Do you have any confusion?
No, sir.
Okay, all right, nice. Okay, all right. So pneumocyte cell, Clara cell, this is something we have covered. Now, can you tell me what is the role of the surfactant actually? What is the role of the surfactant? Next, the function of the surfactant. If I say the function of the surfactant, if this is alveoli, you know, when it is having air, it is inflated well. But when you are losing actually air, what is this? What is supposed to have like this? It will collapse, but it never happens. So in the inspiratory phase, when I am in inspiration, I'm taking the air, my balloons of the alveoli, they are inflated. Well, all right. But do you think at the level of the expiration, your balloons will be like this? No. So who will maintaining this function? Yeah, in inspiration, my balloon is like this. In expiration, my balloon is like this. But it is not completely collapsed. Okay. All right, beta. So can you tell me that who is doing this work? So first you tell me what is the name of the force which is actually helping air drops or water drops to collapse? What is the name of this force?
Surface tension.
Which is, yeah, this is called surface tension. This is every particle on the surface when they will act in such a way, such a force which is the direction is towards the center and the purpose is only to collapse. It's called surface tension. So if I decrease this force, if I decrease this force, my job. So what is the purpose of surfactant? To decrease surface tension. So if you can decrease the surface tension, you can decrease the chance of lung collapse, or you can decrease the chance of alveoli collapse. And this is the role of surfactant. All right. So now I'm telling you, there is a disease in the baby, not everyone. In those babies, basically what happens, they don't have proper surfactant. That's why as soon as they born on the earth, their lungs are collapsed like this. The lungs are collapsed. They cannot take full breathe because the lungs are collapsed because they don't have surfactant. So during the phase of expiration, the lungs are completely collapsed. And even once the lungs is completely collapsed, even you take the air, it is very difficult to inflate. Okay, this disease, when the surfactant is absent, though it's a not that much popular question, but sometimes I find this question in your NEET exam as well. Surfactant absent in babies, this disease is actually called atelectasis. Atelectasis. Or it is also called hyaline membrane disease, HMD. Not that much important. If you don't want to remember, not required, I think, because it is not mentioned in NCERT, not required. Because I found one of the NEET exams in earlier days, but it's not that much important. Chalo, we are discussing to the next one. So anatomy portion we have covered. Now we are directly moving to the questions which are based on the respiratory physiology. I mean the breathing physiology. Okay. So in the breathing physiology, the first question will be, what are the inspiratory muscles? What are the expiratory muscle? What are the inspiratory muscle? Okay, first I should draw actually the ribs. If I draw ribs, you know, this is something called sternum or breastbone. This is called sternum or breastbone. So if this is the sternum or the breastbone, you know, this is the clavicle, which is called collarbone, and remaining, you know, this is something called ribs. So I just want to tell you what is called intercostal muscle. Intercostal muscle is a muscle in between ribs. It's called ICM or intercostal muscle. You know, intercostal muscles are two types. One is internal intercostal muscle, and this is external intercostal muscle. So if I say I intercostal, if I say E intercostal, you have to remember I intercostal is not helping in I, rather it's helping in E. So internal intercostal is mainly helping in better tell me.
Inspiration.
Inspiration or expiration? Expiration.
Inspiration.
And here E is not equal to E, rather external intercostal muscle mainly helping in
Inspiration.
Now you have to also mention another name of the muscle which is having a very vital role in the respiration. What is the name of this muscle? 70% role of the respiration process is due to this muscle. Can you tell me? Which is actually, yes, it is actually divided between the thoracic cavity and abdominal cavity. This is actually diaphragm. And diaphragm itself is also a muscle. It's a muscle, diaphragm muscle. If I say diaphragm is the main principal muscle of the respiration, you can also consider other one like internal intercostal, external intercostal. But can you tell me, if I say diaphragm is the main muscle of respiration, can you tell me which nerve is main muscle, which nerve is most important for respiration? That nerve which will supply, tell me.
Vagus.
That nerve, no, vagus will not supply your diaphragm. So the answer will be phrenic. Phrenic nerve will supply to diaphragm. Vagus will supply to the alveoli. Okay. So phrenic will supply to the diaphragm. So the important nerve for respiration is which one, beta? Diaphragm. All right, yes or no? Yes or no?
Yes,
Chalo.
sir.
Okay,
Yes, sir.
now you tell me what is the main muscle of expiration? Internal intercostal muscle, that I have already explained. You also know how to explain this process of inspiration and expiration. Yes, do you know or not? I
Yes,
think
sir.
yes. I think yes. So you tell me that during the inspiration, what will happen? During the inspiration, what will happen? Suppose I want to inspire. What I have to do? Suppose this is the diaphragm. Okay. Suppose this is the chest. This is the abdomen. So during the inspiration, what will happen? This is the lung. During the inspiration, what will happen, beta? Okay, what is the
Diaphragm constrict.
Okay, very good. So this
Diaphragm
time,
would be
so
flattened.
very good, very good. So diaphragm will be flattened. If you have watched my video, I have repeatedly explained that in the video that when it is contracting during the inspiration, the diaphragm has to come down. It should be flat. Okay. So you tell me. So this is the relaxed phase of diaphragm, but this flat phase is the, tell me, beta, contracted phase of the diaphragm. Now you tell me in the relaxed phase of the diaphragm, what you are expecting? The volume of the thorax is more or less. This is the volume of the thorax.
Yes.
Less.
Yes, this is the volume of the thorax is less. But when it is flat, then you are getting additional this volume. So at that, because at that time the volume is completely this. So when your diaphragm is contracted or flattened, the volume of the thorax is, tell me, increased or more. Now you tell me when the volume of the thorax is more, but your lung is like a, your lung is made up of many balloons. Okay. So, when your volume of the thorax is more, but your balloons are present in this way. I mean, it's in its original conditions. So what would happen? There is a negative pressure. Yes or no, beta? So
Yes,
as your thoracic cavity volume is more due to the expansions of the thorax, but still your lung space is limited. I mean, your lung size or volume is limited. So what would happen next? That there will be creations of some negative pressure inside the thoracic cavity. That pressure will be also transmitted in the lung alveoli. And when you will find that lung alveoli, inside the lung alveoli, there is some negative pressure. With that negative pressure, there will be continuous suction like these and these and these and these, even from the nose. I mean, directly, and ultimately it will be result in suction through the nose to the lung alveoli. Are you getting yes or no?
Yes, sir.
So can you tell me the entry of the air? The entry of the air is passive or active?
Active.
Listen, there is a 2 MCQ. There are 2 MCQs actually. First MCQ is that if anyone is asking you the inspiration process is active or passive, then you have to answer it's an active process, because for the contractions of this diaphragm, for the contraction of the diaphragm, you require ATP. Okay, but if anyone is asking you the way of entering oxygen to the respiratory passage during the inspiration, active or passive? It's a passive entry of the air due to the creation of suction pressure like this. So better to mention suction pressure, and that suction pressure will suck air. Clear? Clear,
Yes, sir.
everyone? During the expiration, okay, all right. So volume, if the volume is less, that will happen. Okay, and expression is exactly reverse, that you already know. The next question. Okay, this capacity and tidal volume wala thing. Can you remember that capacity and tidal volume wala thing? Yes or no, beta?
yes, sir.
Okay, so to remember that capacity and the volume wala thing, what I told? To remember this graph. In that graph, what are the volumes? Can you remember? 1.2, then tell me 2.5, then tell me 3, and then tell me 6. These are the basic volumes I asked you to remember. And can you tell me what is this 1.2 actually known as? Okay, I will explain. By this time, you just tell me when I am inspiring normally, like normal entry up there, a normal exhale, nothing I am doing forcefully. Okay, then during inspiration, my curve will be like this. During expiration, my curve will be like this. For inspiration, I require 2 seconds. For expiration, I require 3 seconds. So what is the total duration of one respiratory cycle?
5 seconds.
5 seconds. So how many respiration I will continue in 1 minute?
12 to 16.
Yes, correct answer. So 12 to 16 respiratory cycle I will continue in 1 minute. Anyways, the next question is that this is a normal respiration, normal breathing. Okay, normal breathing. And that's why this volume, I mean the volume between 1.5 liter and the 3 liter is known as, which is a 500 ml volume. This is known as, tell me beta.
Tidal volume.
Which volume?
Tidal volume.
Very good. This is called TB or tidal volume. Next, you tell me, if I put pressure, if we put force, and I want to take deep breath like this, then what would happen? That above this volume, this is a normal one. Above this volume, I can take certain amount of air, but definitely there's also limitation up to this. So this excess volume that I can take is known as, tell me, inspiratory volume. Okay, all right. And I think you have idea what should be the inspiratory reserve volume. It can be from 2.5 liter to the 3 liter. You can see up to this. Now again, I'm relaxing. I'm exhaling. This coming like this. And next, what I'm doing, I'm forcibly exhaling my air like this. Forcibly exhaling all this air, but still there is a limitation. I can reach up to this, not beyond it. So what is this, beta? The maximum amount of the air forcibly I can expel. It's known
Residual volume.
as not residual. This is expiratory reserve volume. This expiratory reserve is like I can expire that air, but that was kept in reserve. Right now I am exhaling that air. Are you getting me?
Yes, sir.
Okay.
Yes.
So this is called expiratory reserve volume. Now you tell me, you can see that few amount of the air that can be, even after this entire effort, you cannot exhale this amount of the air. So always you cannot make your lung empty with your all effort, all ATP. That amount of the air will always present in the air system. Can you tell me the name of the air? This is called residual volume. Yes, absolutely correct. So this is called residual volume. Okay, so all right, what are the volumes we have read? This is called inspiratory reserve volume. This is called tidal volume. This is called expiratory reserve volume. This is called residual volume. So we have read 4 volumes. But if we make some permutations and combinations with this volume, we will get some capacity. So what is the difference between the volume and the capacity? Volume is a single unit entity, but capacity is nothing but the permutations and the combinations with different volumes. So if I add the tidal volume along with the inspiratory reserve volume, what would be the name of this form? I mean,
Inspiratory capacity.
Yeah, very good, very good. This capacity will be known as IC or inspiratory capacity. All right. And the next one is again very important. And in the next one, again very important, that tidal volume with this one. So this should be known as
Expiratory capacity.
expiratory capacity. All right. Now, can you tell me if this is inspiratory or this is expiratory capacity? And if I starting from this to this, what should be known as?
Lungs capacity.
Total lung capacity.
Total
Okay.
capacity.
All right. Okay. All right. And if I say you, if I say you, what is the format? If I just join this reserve volume with this expiratory reserve volume with expiratory reserve volume.
Vital capacity.
No, this is functional residual FRC, functional residual capacity. Okay. And if I join this 3, I mean TV, IRV, and ERV, this is called
Vital capacity.
this is called vital capacity. And I think with the help of this permutation, and you can follow this marker. Following this marker, you can say any answer. Well, if I say what is the vital capacity, then you can say like from 1.2 to the 6. I mean, what it is like 4.8 is the maximum. So you can say like 3.550 liter to the 4.8 liter. If I say what is the volume of the residual volume, you can say 1.2. If I say what is the volume of the FRC, you can say 2.5 minus 1.2, then 1.3. Clear everyone? Yes or no?
Yes, sir.
Yes, sir.
All right. Okay, all right. And the next question is very important. This question is mainly based on the tissue exchange. I mean, exchange of air in two levels. We need to exchange our gases at two levels. One is from, one level is alveoli and blood. This exchange will be conducted with alveoli and blood, this level. Another exchange is at the level, the tissue level. I mean, in between the blood and the tissue. Clear, everyone? Clear, everyone? So
Yes, sir.
one level. So first level of exchange is at the level of alveoli with the blood. A second level of exchange is the tissue with the blood. Yes or no? Now there
Yes,
is a
sir.
very popular MCQ. This chart. This chart is extremely important. I will this chart. This chart is extremely important for NEET exam. Extremely important. Okay. If you ask me, sir, sir, tell me the most important 40 questions or 30 questions, I will definitely put this chart, one of them. This chart is extremely important. And in my detailed lecture, I have explained how to remember this chart and what is the benefit of this chart. This chart is actually helping to maintain the exchange and diffusion principle. They are maintaining actually the diffusion principle. So first you have to remember, and in this chart there's a beauty. This is the PO2. What is the PO2? PO2 means partial pressure of oxygen. This is called partial pressure of oxygen. This is 104 millimeter mercury. And this is PCO2. I mean, this is the partial pressure of carbon dioxide. This is 40. Clear, everyone? Just follow me. Just follow me. It's extremely important. Just follow me. So if I say this is the partial pressure of oxygen, this is 104. This is a 104. Can you tell me what is the percentage it signifies, its corresponding percentage? I mean, if I say the partial pressure of oxygen is 104 millimeter mercury, so how many percentage of oxygen you are expecting there? How many percentage of oxygen you are expecting there? Can you tell me? I told you a simple trick. The question is, if the partial pressure of the oxygen is 104 in the alveoli, can you tell me that what is the percentage of oxygen? I mean, percentage, volume percentage is not same with the pressure. If I say the pressure is 104, can you tell me the what percentage can you get here? It is 13% oxygen. So in alveoli, what is the percentage of oxygen? 13%. In atmosphere, what is the percentage beta of oxygen? 20%. In atmosphere, what is the percentage of carbon dioxide? 0.04. What is the percentage of PCO2 here? So you can see almost if you divide with the help of 8, you will get the result. Okay, all right. But mainly in your NEET exam, most of the time I found they are asking the question in forms of pressure actually. So no need to worry. At least you have to remember that partial pressure of oxygen will be 104. Carbon dioxide will be 40 millimeter mercury. Now you say me, why this diffusion is occurring? Definitely the oxygen pressure is more here and the oxygen pressure in the pulmonary artery is less. That's why we can expect the oxygen flow as a law of diffusion from alveolar air to the pulmonary artery. Yes or no? Yes or no?
Yes, sir.
Now, can you tell me what is the percentage of oxygen, partial pressure of oxygen in pulmonary artery? Do you know?
45, sorry, 40.
40. It's low. It's so low. No. Can you tell me? You have to follow this one. Okay. The artery, atmospheric wall, alveoli, blood. Okay. This is very important. You have to remember, and I will also explain how to remember. But this is very important. So you have to remember that when the blood is deoxygenated, your oxygen is 40. Okay. And carbon dioxide is 45. All right. Yes or no?
Yes, sir.
Okay. So again, I just want to tell you, if this is the blood, so what is the percentage of oxygen here? Partial pressure of oxygen 40 millimeter mercury. And if I say this is the CO2, what you are expecting? What should be the CO2 here?
45.
45.
45 millimeter mercury. Now, by the law of diffusion, you know, oxygen can pass from here to there. Yes or no? Yes. And this is 40, and partial pressure of carbon dioxide is 45. So, you know, carbon dioxide can go from here to here. Yes or no?
Yes, sir.
Yes. And after the exchange is over, there is an end point. The end point of exchange is not 104. Rather, the end point of oxygen here is actually, you have to remember this information. Here, the end point of oxygen is actually 95 millimeter of mercury. So at 95 millimeter of mercury, the oxygen exchange will stop. And that's why it is like 104 finally in the pulmonary vein you are getting. And if I say what is the final CO2 in the pulmonary vein? Tell me, pulmonary vein, what is the CO2 you are expecting here? It is 40, okay? It is 40. So you can say that, yes, sir, it was 45 and the exchange process goes until it becomes 40 on the both side. And that's why this is the 40. But for oxygen, better, you have to remember, you can't expect 104 here. Rather, you have to remember, you can say this, that, sir, oxygen is 40 here. So I think the diffusion process should continue until it becomes 40. But no, it would continue until it becomes 95. So 95 is the oxygen in the artery level. CO2 is 40 in the, 95 is oxygen in pulmonary vein level, and CO2 is 40 at pulmonary vein level. Clear up to this, yes or no?
Yes, sir.
So you have to remember the arterial values, you have to remember the venous values, and you have to remember the alveolar air values. Okay. All right. All right. This is something we have already covered, the layers of exchange of gases. The first layer, the alveolar cavity along with its cell, and this is the interstitial tissue, you already know. And this is the basement membrane. You can say also basement membrane. Actually, they have marked it wrongly. This is not basement membrane. Basement membrane is this and this. Anyways, but still they have marked basement substance. That's why they have told. And this is the last topic of the day. This graph. Telling this graph, I'll finish the class. Okay. By this time, I want to tell you another more important information, which is very important. I think you should know. And that is the transport of gases. Okay. Suppose I have already, suppose this is the alveolar air. Okay. Suppose I have already transported successfully the gases to the blood. I have transported oxygen. I have transported the CO2. My question is that when I have transported the CO2, how the CO2 will be transferred from one part of the body to the another part of the body? So most of the time, you have to remember, first I'm talking about the O2. You have to remember the O2 will bind with hemoglobin. They will form oxyhemoglobin. The oxyhemoglobin is something, initially it will be like HbO2, then it will be HbO4, then it will be HbO6, then it will be HbO8. So how many maximum number of the oxygen molecule can be held by one hemoglobin molecule? Who can tell me the answer?
8.
Not 8. How many oxygen molecule? 4. 4. Absolutely correct answer, 4. Okay, all right. So you have to remember maximum hemoglobin can be held with one hemoglobin molecule is 4 O2. Anyways, and that will actually circulate all over the body. Now I have to tell you how much percentage of the, suppose there are, I guess, like 400 ml of oxygen which is actually transferring from here to there. Can you tell me that what percentage of oxygen is transported with binding with hemoglobin? 97%. But what else? What happens with the 3% oxygen which doesn't bind with oxygen? That remains dissolved. So oxygen will be transported in dissolved format in 3% volume, 3% volume of the total oxygen, and 97% volume of the total oxygen will be transported as what? Will transported as, tell me?
Oxyhemoglobin.
Oxyhemoglobin. Now I'm talking about the another part, carbon dioxide. So here is the same way. Carbon dioxide will be transported with binding with hemoglobin, which is called carb amino hemoglobin, not carboxy. This carb amino hemoglobin. How many percentage of carb amino hemoglobin will be, I mean, how many percentage of CO2 will be transported in carb amino form?
20%.
Correct. Okay. Next, few percentage will be transported in dissolved format. What percentage? 7% will be transported in dissolved format, like 3% of the oxygen. And remaining percentage, I mean almost 70% of the CO2 will be transported after formations bicarbonate. So bicarbonate is huge in your blood. So you have very good amount of bicarbonate in the blood, because in your blood, if you see the biochemistry of the CO2, how they are transferring in the body, 70% of the CO2 that you are producing at the tissue, they are actually transported. Suppose this is the tissue. Suppose this is the tissue. Okay. Suppose this is the tissue, and suppose my tissue is producing. This is the tissue, and my tissue is producing CO2. So 70% of the carbon dioxide will be transported in format of bicarbonate. This is a very important question. All right. Now, next, I am directly moving to the final concept, which is called oxygen saturation curve. In this curve, we will put oxygen concentration of oxygen in the x-axis. In the y-axis, we'll follow what percentage of the hemoglobin will be saturated with supplying the oxygen. So if you follow this curve, you will get a curve which is like S-shaped. I mean sigmoid shaped. Okay. In this curve, you will get that when initially you are increasing the oxygen, the hemoglobin percentage are increasing in the y-axis. Why again, x-axis you are increasing the PO2, in the y-axis you are getting more saturation of the hemoglobin, and then at some point of time you are getting the rate very high. But at some point of time, when all the hemoglobins they are bound with oxygen, even after increasing the CO2, you cannot increase the, tell me, you cannot increase the saturation. So this is the called 100% saturation. So if this is 100% saturation, if this is 0% saturation, obviously at the middle you will get the 50% saturation. Yes or no, beta?
Yes.
And,
Yes, sir.
and the point when it will cut the graph at the 50% saturation, if you put a perpendicular on the x-axis, you will get some value of partial pressure of oxygen. Yes or no? So this value of partial pressure of oxygen, which will help in 50% saturation of the hemoglobin molecule present in the blood, is known as P50. So what is P50? P50 is the value of the pressure of the oxygen in the atmosphere, which is needed for the 50% saturations of the hemoglobin available. Clear, everyone? Okay, all right.
Yes.
Now the next question is that if I draw a curve at the right side of the main curve, I am using different color. If I'm drawing another curve at the right side of my main curve, like this, if I draw another curve on the left side of the main curve, both are sigmoid, but the places are changed. Now you tell me, for the first, like this is the first one, this is the second one, this is the third one. Tell me for the first curve. For the first curve, to get the 50% saturation, you are again dropping the legs on the x-axis so that you can calculate the amount of the oxygen required. So can you tell me, for the 50% saturation, for the graph number 1, how much amount of oxygen you are requiring, more or less? More. Absolutely more. So if I say the P50 value, for the 1 is more than P50 value for 2. Do you agree?
Yes, sir.
And if you follow the third curve here, to get the 50% saturation, you require only this amount of the oxygen. So here the P50 value for the 3 is least. Yes or no?
Yes, sir.
So what does it signify? What does it signify? Chalo, I am explaining in a very good way. It is like, if you have a very good hunger for the food, will you take the food? Will you finish the food first or last? First. But if you don't have any hunger for the food, then even after getting a lot of food, you will not eat anything. So what is happening? You just tell me what is happening in case of 3. Getting a less amount of oxygen in the x-axis, in the y-axis, they are absorbing that oxygen. So here the attraction between the oxygen with the hemoglobin in case of 3, more or less?
Less.
Less. Again, I'm explaining. Again, I'm explaining. With less amount of oxygen, you are getting 50% of the hemoglobin, 50% of the saturations. Only with a very small amount of the oxygen, you are getting 50% of the saturation. Yes or no? Yes. So here the attraction of hemoglobin to the oxygen is more or less? More. In case of 2, if we compare with respect to the 3, in case of 2, the attraction between the oxygen and the hemoglobin is more or less with respect to 3?
Less.
Less, yes. Because you need to put this amount of oxygen, more amount of oxygen to get the same concentration, to get the same saturation. Okay, I'm explaining in this way, in a very simple way, okay? I'm considering 3 people are there, okay? Number 1, number 2, and number 3, okay? Number 1 is the person, okay? Number 1 is the person who is not having proper amount of the appetite, who don't want to take any food, okay? All right. But if you request, he can take the food. Number 2 is the person, he has moderate amount of the appetite. If you give the food, he will eat. Number 3 is the person who is having very strong appetite. Very strong appetite. If you give a small amount of the chocolate, he will eat and finish it at once. Okay. Now you tell me who is having, so what type of graph you are expecting? Number 3 is this. Number 3 is having very strong appetite. So even with the small amount of the oxygen, it is getting the 50% saturation. Number 2 is the moderate amount of food appetite. So it requires a more amount of oxygen to fulfill its saturation. But number 1 is having very least amount of appetite, very least amount of attraction. So it requires a very high concentration of oxygen to get the similar saturation. Are you getting me?
Yes, sir. Yes, sir.
Okay. So number 1, more oxygen, same saturation. Number 2, less oxygen, 50%, same saturation, 50%. Number 3, least oxygen supply, still same saturation. Now, what are the conditions for number 1? How you will get the number 1 condition? How you will get the number 2 conditions? So to get the number 1, okay, first you have to know the number 1 condition is called right shifting of the curve. Number 3 condition is called the left shifting of the curve. So right shifting of the curve will happen in these conditions. Number 1, if you have more carbon dioxide. Number 2, if you have very high hydrogen concentration, I mean acid. I mean, if you have the pH less, that is acid. If you have 2,3 BPG, BPG is bisphosphoglyceric acid, is acid. So these are the conditions where basically you will break the bond between hemoglobin and oxygen. That's why it will require more and more oxygen to saturate 50%. Are you getting me or not? Again, I'm explaining. If you supply more CO2, if you supply huge acid, if you supply very less pH, I mean very strong acid, or if you supply more 2,3 BPG, which is phosphoglyceric acid, if you supply this condition, or if you supply very high heat, number 5 is heat, then what will happen? The bond between the oxygen and the hemoglobin will not be strong enough. That's why you have to supply a good amount of, a more amount of oxygen to get 50% saturation. That's why the curve will be in the right side. Are you getting or not? If you impose the exactly reverse condition, I mean less oxygen, less carbon dioxide, more basic condition, I mean less acidic conditions, pH is high, or 2-3 ppg is less, then you will get right shifting of the curve. But apart from that, apart from those, I mean 1, 2, 3, 4, 5, apart from those normal, you are what we have already explained in this one, you have to remember there is another condition. That condition is called fetal hemoglobin. In fetal hemoglobin, we will also get left shifting of the curve. Why? To answer this why, you have to know the structure of the hemoglobin of adult and fetus. So if you see the adult and if you see the fetus, adult hemoglobin is alpha 2 beta 2. I mean, along with the heme molecule, we have 2 alpha chain, 2 beta chain in adult. In fetus, we have 2 alpha chain and 2 gamma chain in fetus. There is no beta chain. Now, beta, you have to remember, beta doesn't love oxygen so much, but gamma loves oxygen so much. That's why what you are expecting, if you are finding your hemoglobin is loving oxygen so much, and the bond between the oxygen and the hemoglobin is so strong, what type of curve you are expecting, right or left?
Left.
Obviously left. Obviously left. Because your hemoglobin is loving oxygen so much, you require least amount of oxygen to saturate 50%. If you have a very strong appetite, if you have very strong hunger of oxygen, then you will require less amount of oxygen. I mean, the value on the x-axis will be less, and the curve will be on the left side, not the right. Should I explain again?
No, sir.
Do you have anyone? If
No.
you have any doubt, feel free to ask. Because at the end of the class, because it's a revision session, it's not like a normal class. So everyone should have the idea, should got this point. If you don't, I will repeat again. And if you're not getting, this video will be also available in the channel. But still, try to ask me the questions. It's for your benefit. Your time will be. You will require. You can put at same time in solving MCQs if you understand in class. So try to understand every concept in class so that you can put adequate time in solving MCQs. And there is no escape route of solving MCQ. The more you will solve MCQ, the more you will be habituated to solve MCQ. Your reflex power will increase. Like the batsman, the more shadow practice will be there, the more reflex to hit the ball will be, and the more the MCQ you can solve in the exam. The same thing. So you have to repeatedly solve MCQs of different, not different. Solve one book, not different. What I am to say, you have to finish every MCQ from the first page of the book to the end page of the book for a single book. That's enough for you. Okay. And definitely we'll do many work. We'll do like revision sessions. We'll do some master revision session. We'll do some quizzing sessions. Okay, right now your mentors will do some quizzing sessions with you, and everyone in that sessions, everyone has to turn on your video, because we will ask you the questions with your name. So say this answer, say this answer. Or we can also take live test. Live test is like it's not like the 180 questions which you give in the website. It will be like 30-40 wala MCQs, which will be exactly like real-time exam. I mean, you have to turn on your video. We'll check you that whether you are taking help of book or not. Okay. So all right, so do these things. And the surprise test, this is something called surprise test. The surprise test also can come at any time. So be prepared for it. And whatever the feedback you have from your any class, be it your physics, chemistry, biology, just convey it to your mentorship group. You have your own space to convey that. So feel free to convey. Okay. All the best. If you have any query, you can ask. Otherwise, I'll leave this session. So if you have any query, Amrita, Anindita, Ankita Mondol. I think this is Ankita Day. Okay. So Ankita Ghoshal, Ornob, Deepti, Ritom, Jeet, Nilanjan, Sridhatri, Shreya, Soheli, Shumaya.
স্যার এটার আরেকটা
And
কারণও তো
yeah,
হতে পারে।
Yeah, say, continue, please.
Sir, absence of BPGA in fetal hemoglobin.
Absence of BPGA. No, not like that. BPGA is also present in the fetus. No, not like that. BPGA. Why BPGA? What is the BPGA? Do you have the? I think if you have read those things, like if you have read the respiration process, I think you know in the respiration process in the glycolysis. In the glycolysis, there is a set of reactions. Have you read the glycolysis? In the glycolysis, there is a production of BPGA from PGALD. Okay, so from phosphoglyceraldehyde in the glycolysis, you can produce bisphosphoglyceric acid. So how you can avoid? Do you think fetus don't respire in the cell? Do you think that do you think that in the fetus you won't have any glycolysis process? Definitely, in the fetus we'll also have the glycolysis process as a part of cellular respiration. So they do also have the BPGA in the cell, in the blood. All right. So any more query?
Yes, sir. আর একটা কোশ্চেন ছিল।
Yeah, sure.
স্যার লাং বা লিভার এরা কেন লোব হিসেবে থাকে? মানে পুরো একটা সিস্টেম হতে পারতো তো।
No, basically what you have to understand when you are saying about the any organ like lung or liver, so they are in lobe. Okay, liver is like in basically two lobes, though it's basically due to the embryo origin. Okay, what happens in such organ, any structure will go inside it which will divide it into two parts. Okay, so there's no such explanations actually how they have divided due to the anatomy. Either any particular features they have passed and they have made the lung into three lobes. This is the reason. There's no specific need actually. I can explain the reason that, but there's no specific need, that there's no special benefit actually. Do you have any more question? Otherwise we'll leave these sessions. Okay, so we are leaving these sessions. Nilanjan, you should turn on your video. Okay, from the next day definitely you have to turn on your video. Okay, all right. So bye bye, take care, lots of love, lots of blessings.